A cardiac arrest, which gets to ROSC, a return of spontaneous circulation, triggers an explosion of secondary injury in the brain that lasts for hours and even 2 to 3 days. There seems to be an extensive window of secondary injury, and we need to start to think more about early monitoring. Early EEG with early recovery of EEG findings towards normal can actually identify at a very early point the people that are going to do well. As the EEG recovers, then maybe so as the patient will recover. Overall, they found status epilepticus in 22% of these cardiac arrest patients. The seizures began as early as 4 hours and as late as 40 hours after ROSC. These seizures are very damaging to the brain. So the cardiac arrest demands emergency EEG. 2020 new guidelines for CPR and emergency cardiac care came out. For the first time, EEG monitoring has been acknowledged as something that we should be doing in all of our non-command following or brain injured cardiac arrest patients. This whole idea of doing very early EEG is a very new concept, but it makes sense. If you're going to get a head CT off the bat, why don't we start thinking about early rapid response EEG? Let's start to see if we can get early detection of ictal activity and find out if early treatment can actually reduce brain damage and lead to a better outcome. It's a new era. We used to talk about CPR, cardiopulmonary resuscitation, and now it's all about the brain. It's all about CCR, cardiocerebral resuscitation.